San Diego's breaking news leader. This is News 8 at 6.
Before you hit the beach this summer, remember, pack your sunscreen, especially if you have little ones.
That's right. Coming up next, a dermatologist joins us live with ways to keep kids safe from the sun and avoid those nasty sunburns. We'll be right back. Well, June is National Cancer from the Sun Month, and as parents, it's our job to keep our kids safe, and a person's chance of obtaining melanoma later in life doubles after just one sunburn as an infant, and it's so important. Well, this morning, I'm joined by Dr. Melanie Palm with ways to protect kids' skin at a young age. Oh, and you are beautiful, and we're joined by Bay as well.
Look at my model. She's upstaging us both.
Sweet.
We're excited to have Bay here.
And Bay is 7 years old,
yes.
And oh, you're both beautiful. Thank you so much for being here. There's so much information, and we were just talking about kids' safety, and it really does happen at such an early age.
Yeah, and this is really coming at a good time because there is a new FDA rule on sunscreen, so sunscreen labeling is going to change a little bit in the coming months. And then it's really important to know by age how we need to protect our children's skin. So in general, if your children are 6 months or younger, you really want to just photoprotect with clothing itself. And there's great clothing that's out there now, using an actual hat, something that's a little bit broad-brimmed, using sunglasses that show that they actually block UV, both UVA and UVB, and then also wearing things like rash guards that have UPF, which is similar to sort of SPF, but for clothing, is a great way to protect the young ones.
And so you're saying that even on the actual clothing and the sunglasses and the hats, that will be labeled differently as well?
Exactly.
Ah, for children's...
The clothing won't, but in terms of the sunscreens, there's a little bit of change. So now there'll be a term called broad spectrum, which will mean that sunscreens cover both UVA and UVB. And then for a sunscreen to be considered sort of effective in terms of warding off sunburns, to be labeled with at least an SPF of 15 or more. The American Academy of Dermatology usually recommends an SPF of 30, and that's what I tell my patients myself.
Well, your skin is absolutely flawless and beautiful, and it's and it is so true. As my husband has had some skin cancer burned off, and he said he spent time in the sun early, and it does hit now, and this is what we're seeing.
Yeah, I mean, a lot of mine is virtue of growing up in the Midwest, but I think, you know, I'm always surprised. I see pediatrics to mature adults in my practice, and I see teenagers with melanoma, and I see young 20-year-olds with skin cancers. So I think it's really important that we're choosing the right sunscreens. And so for the most part, I tell patients to really look for a physical blocker, something that's an inorganic filter. The best of these is zinc oxide, and then the next best is titanium dioxide. I brought a couple of lines here. The Elta line, which is a great one, is dispensed out of physicians' offices, has 9% zinc, which is a fabulous amount of zinc to protect the skin. Some of the other ones over the counter have chemical sunscreens, which work well as well and have nice preparations you can put over even wet skin.
Yeah, you can dilute them too a little bit, though,
yes,
right?
you can.
Now let's talk a little bit about, we'll show Bay a bit, but because it's really important to get it on the part of your head.
It is. There's areas that we forget about in our children, so it's really important either with a hat or if you can get in with like some spray sunscreen to use it on the head, to get behind the ears, behind the neck is an area that we forget about, and also the shoulders so that we're not getting them burned.
Yeah, and for little boys who have them exposed with the short hair too.
Absolutely. Ears, tips of the ears is a big place that people forget.
Yeah, and I know, those little short haircuts we were talking about, right, like just literally right on top of the head. And we have like maybe 20 seconds left. Anything else that we can talk about with little ones that's so important?
I think it's important if you can apply before you actually go out, because by the time if you go outside and then are applying, you've probably been out in the sun for about 20 minutes. So you want to do that first application inside. With activity, you want to be reapplying about every hour and a half to ensure that you're not burned. From 10 a.m. to 4 p.m., you want to try and avoid those peak hours when your shadow is very slim. It's not long shadows. That's safer times to be outside. And then just sort of bringing the umbrella to the beach and making sure that you're seeking shade is a great tip.
Very good. Excellent advice. We do have more tips from Dr. Palm. Thank you so much. And you can just log on to our website at cbs8.com and click on our hot button. Hot. That's going to apply for today too, because it will be. Thank you so much. We will be right back with more news, weather, and traffic. Stay with us. Thank you.